It's great to talk to everybody today. And as I said, my name is Mark Radford. I'm the Chief Nursing Officer for Health Education England and Deputy CNO. My role and responsibility with our organisation, Health Education England, which is a partner to today's event, is the support and training of healthcare professionals across both the NHS and also the wider healthcare arena, including areas of social care. This event and Health Careers Conference is something that we think is really important to sponsor because it is really important to highlight the opportunities that healthcare careers can give many, many people. And today I really kind of want to concentrate on the aspects of looking at nursing, midwifery, allied health professionals. But of course, I know that many people logging online today, having looked at the chat, are interested in the range of professional opportunities there are within health, including medical, scientific, and a range of other certainly important opportunities that maybe I'll touch on a little bit later. But of course, this year is very, very different. And I know that for many of us working in healthcare, this has probably been one of the most challenging times for all of us in managing and supporting our countries, but also our communities and also our staff and patients in relation to the COVID-19 outbreak and pandemic. And it goes without saying that I would really like to sort of put out there that our healthcare professionals across the NHS, social care, and also globally, I think are doing a phenomenal job in terms of their safety support and improving the outcomes for their communities. And it really does go to show how important healthcare careers are internationally in relation to the fight of the pandemic, but also importantly to local communities and the outcomes that we're trying to improve, not only now, but in the future, in relation to some of the health challenges that many of our nations, but also here in England and the United Kingdom, that we face. But today is about career opportunities, and I think it's really great that we've got such a wide variety of talks during the conference online today that look at a range of opportunities. But this year has been nominated by the World Health Organization of the International Year of the Nurse and the Midwife, and in fact, actually, they're going to run it into next year as well, because they want to showcase and highlight the opportunities that nurses and midwives across the globe have had in relation to both careers and also importantly the health of the nations that they support. It is really, really key to identify that actually being a nurse, and I've been a nurse now for over 25 years, is a fantastic opportunity and a fantastic career. And I kind of want to talk a little bit about some of my kind of experiences and also how I've been able to navigate, I think, a really, really exciting career in nursing. I first graduated from nursing in the 90s from a degree programme here in Birmingham. But nursing is now a graduate programme across England, but also importantly, it's a graduate programme internationally. So many of the degrees for nursing are either 3 or 4 years. And in fact, in some cases, we do an accelerated programme for those people who have got a science or even a humanities degree prior to wanting to come in to do a nursing programme. Now, nursing has a number of branches. I'm an adult nurse called a registered general nurse, but we also have important opportunities in mental health, learning disabilities, as well as also paediatric nursing. And many international examples are out there in relation to the career opportunities to work with different client groups, different groups of patients and service users. But of course, when you train to become a nurse, which I did in the early 90s through a degree programme, I went on to work in hospital settings, and I particularly worked in emergency and trauma. And part of my role was working for those patients who were presenting with major illness and injury into emergency departments. But of course, there is huge opportunity for them to be able to go on to develop your skills and experience. And I was really fortunate enough to be developed and trained to become what's called an advanced clinical practitioner. So I was able to advance my skills through a master's degree program after this, very similar to what we see in nurse practitioner, clinical nurse specialist type roles in the US, which means that you develop your skills and also support the teams in very, very different settings. So ultimately becoming a nurse consultant in emergency and trauma surgery, which was an exciting time in terms of both my career development, but also the opportunities that I could use my nursing skill and expertise to support improved outcomes with patients. But alongside this, I've also been an academic, and I work at one of our local universities here, Birmingham City University, which has a long history in terms of training and educating healthcare professionals. And being an academic nurse as well also means that I've conducted research and continue to conduct research, particularly looking at improvements in outcomes, looking at workforce development, but also improved clinical decision making that happens in clinical settings. And recently, in the last 5 or 6 years, I've also been doing leadership positions, so leading hospitals and organisations, as well as also now nationally in terms of the training and education, and also the delivery of the support in relation to the services of the NHS. So nursing as a career can take you many, many different directions, and it is really fantastic that actually, like myself, obviously you could work within a hospital setting, but also you're working in people's homes in general practice, as well as also community mental health, and also, as I've said, learning disabilities nursing as well. So it's hugely diverse, both in the setting, but also importantly in terms of the opportunities that you'll get to work in clinical practice, in research and leadership, as well as also the development of policy. So there are great and fantastic opportunities around career development that are really important to highlight around nursing and midwifery within, certainly here within the United Kingdom, that these examples exist globally in terms of the opportunity. And I think that's one of our real challenges, actually, is something that I speak to many, many people thinking about healthcare careers all the time, which is that many people don't necessarily understand that actually becoming a nurse is now a graduate profession, like many of our healthcare professionals, including allied health professionals as well as scientists. But also the skills, expertise and competence required to be a nurse managing complex conditions, irrespective of whether you do so within a hospital setting, community or general practice. The kind of old yesteryear images of nurses wearing hats and other types of old-fashioned image of nursing really are consigned to history now, as we see the development of nursing expertise and skill working alongside doctors and other healthcare professionals in clinical settings to improve outcomes for their patients. I've described one, which is the development of advanced nursing practice, which sees, I think, some really exciting opportunities for nurses who manage their own caseload of complex patients within all sorts of different settings, prescribing of medications, as well as also treatment plans and profiles as well, but also leading and managing populations health alongside other medical staff, and also importantly other health professionals, including allied health professionals and scientists. So there is a wide range of potential for people to relook at and consider careers in nursing that they may not have considered before, because I think it is a really exciting opportunity, a great development, and provides a huge amount of array of potential career choices, not only in types of practice that you will work in, but also importantly in relation to the outcomes, and also importantly the work that you will deliver in care and in the communities that you work in. There have been some really challenging times in relation to COVID, but one of the things I'm most proud of is healthcare professionals across the globe, and where I work within the NHS, really demonstrating the skills and expertise, and no more so than our nursing and midwifery staff. Working alongside other healthcare professionals, they have really risen to quite a significant challenge in the management of this global health emergency. And we see nurses up and down the country using their skills and expertise, currently dealing with some of the challenges that we see in relation to the management of intensive care patients with COVID, but also importantly, the maintenance and continuity of other services, particularly those in areas such as mental health, community settings, and importantly, public health. Nurses are key parts of all of those teams in managing COVID pandemics across the globe, but also importantly here in England, the roles that they're playing in support of community health programmes, as well as also hospital, as well as also the care of those patients and service users who work in and live in community settings. So it's great today to see some fantastic speakers who are going to be talking about a range of different professional opportunities. But here in the year of the nurse and the midwife, I'm really, really proud to be a nurse, and I'm really proud of all of the opportunities that it has given me in terms of the career that I've been able to have. But also importantly, that it can have for many, many people. There are a range of opportunities at the moment. We are currently recruiting into nursing programs. There are postgraduate programs due to start in England between January and March. So universities are still open for recruitment into those programs if you've already got a degree to start the 2-year nursing degree program. But of course, we've also started and launched what we call online blended degrees. Now, that doesn't mean you do your nursing course fully online. Of course, you will be working in clinical practice, but we've partnered with 7 organisations up and down the country and universities, which allow people to have a really flexible approach to their training and education, particularly by using online learning opportunities, and then basing themselves in clinical practice, both in hospital settings and community settings, to make sure that they can gain the clinical experience for them to qualify. So, and again, there are many routes and opportunities into both in your local area, but also nationally to gain an entry place into our universities to start training as a nurse. And of course, this year, we've seen a significant increase in the number of people wanting to come into healthcare careers. And this has been an effect of increased interest in healthcare careers, and notably around what people have seen in terms of the response in relation to the COVID pandemic. So this year we have 23% more nurses starting their training this September, which is a phenomenal increase of people who are interested in healthcare careers across universities across the country, to make sure that there are many places available for people who do wish to study healthcare careers, who have the right grades, and also importantly have the right approach in relation to wanting to be a healthcare professional, but also importantly supporting both the NHS and social care to ensure that we have high quality placements, because I want to be sure that people who start the career have the fantastic opportunities that I had in relation to learning and understanding from the very best, but also importantly having a high quality clinical experience, because that's really important in terms of the skills and expertise that you will develop to work in whatever setting you did. And for me, this I think is a fantastic career. And I know that during the day there are many other opportunities for you to look at a variety of different opportunities within healthcare. But I leave you with a final message that whether you're a nurse, a doctor or an AHP, you're always part of the team. And one of the things that we've seen through COVID and throughout my entire career is how people work so hard together for the better outcomes for their patients or the communities or the service users they support. And being part of a team is a really positive part of being a healthcare professional, because it allows you to certainly look at all of the skills and opportunities that you learn as part of your undergraduate program, but more importantly, as I've said, the opportunities that gives you once you've actually qualified as a nurse or midwife within the NHS. And for me, I've had a fantastic career and continue to develop it as well alongside other areas. So I'm just really, really delighted to be here today to talk through the opportunities it's given me, but also importantly to celebrate the year of the nurse and the midwife, and particularly in this really challenging time of the COVID pandemic. And just to say thanks to all of you who have been under a lot of challenge, both in our society, but also in terms of compliance against some of the approaches we need to take to keep this under control. But also a huge thank you to our staff up and down the country who've been doing an amazing job in support of the communities and tackling COVID-19. So thanks very much. I hope you enjoyed the rest of the day. There's a number of great talks, and this online platform really does enable you to kind of connect and interact. I've seen lots of questions coming up through the chat box, so great way to connect with other people and also to learn a great opportunity around other careers. And so thank you very much.